Okay, welcome to another Zoom call. I'll open it up for questions at the end. I want to clear up some information that's been floating around the internet on the coronavirus, using elderberry with viruses, bacterial infections, and the risk of some cytokine storms. So I think that's a little bit of misinformation out there. We've got a lot of questions about should I take elderberry or give my kids elderberry with a virus? That's not a good thing. It could cause a cytokine storm. Let's talk about that. So a cytokine storm is a hypercytokinemia, which is an excess flow of cytokines, and we're going to explain what those are in a second, into the system, and they can cause a lot of problems. So a true cytokine storm can cause a lot of problems for an individual and damage blood vessel, endothelial cells. They can damage organs. It can be really a horrible thing. And that's actually what takes place with many people that have an autoimmune disease and are wrongly treating their autoimmune disease in ways. And we'll touch on that in just a second. So cytokines are part of your immune system response. So the way your immune system deals with an infection or a toxin or a food peptide or some sort of allergen, or what's called an autoantigen, meaning something in your body that's then becoming an antigen. So anything that is an antigen is something that your immune system is responding to. So an antigen is something that your immune system is recognizing as an enemy. Remember, there's two ways that your body gets rid of things in your body. You will detox chemicals out of your body, heavy metals. Those shouldn't be recognized as antigens by an immune response. However, sometimes they can, and we're not going to get into that in this discussion. But usually an antigen is a pathogen, is a biotoxin, a living organism, a bacteria, a fungus, a mold, something like that, that is now presented to the immune system as an enemy, and the immune system's job is to kill it. Now, inert substances like heavy metals and chemicals and pesticides are your immune system should not they should not be presented to the immune system, and your immune system should not fire a reaction against those things. Those things go through detoxification pathways. There's two ways that we get rid of things in your body. You detoxify things or you kill things. You detoxify things through your liver and your kidneys. You kill things through an immune response. And the way that your body fires an immune response is by creating cytokines. So that's where these different named chemicals, there's lots and lots of them, hundreds of them that come in. But there's main ones here that we'll talk about: IL-17, IL-21, IL-22, IL-2, IL-10. These are all different cytokines that fire different reactions. And the purpose is that they help to present a bad guy, a bacteria or a virus to your immune system and stimulate immature immune cells that are called naive T cells to then create macrophages and mature T cells so that they will be killed. So these pathogens can be killed. That's the whole purpose. So cytokines serve a very distinct purpose. If you didn't have any cytokines, you wouldn't have any immune response and you would die. So cytokines are not bad. Cytokines are normal. You have to have a cytokine response in order to kill a pathogen. So that's the whole purpose. When we give a person immune stimulants, whether it's to help ward off bacterial or viral infections or to help the body kill cancer cells, you are stimulating your body to make more cytokines, to make more T cells, to make more mature macrophages to kill that which we're trying to kill. So a cytokine response is a normal response. A hypercytokine response is not what we want. So let's talk about that. So this gives you an idea. You have a TH17 response, a TH1 response, a TH2 response, and a T regulatory response. Your T regulatory response is to help ultimately balance this all out. But when we have a hyper TH1 response with no pathogen present, no cancer present, no bacterial or virus present, we can damage cells. When we have a hyper TH17 response with no pathogen present, we can damage cells. That's where we can have issues if the body responds to heavy metals instead of something it could kill. So then we have a hyper TH1 or a hyper TH17 response, and it can damage brain cells, damage tissue cells, all sorts of bad things can happen. So let's talk about that. Here's another picture, good way to explain how your body will react to an immune response. These are all normal responses. This is what you want to happen. If you're not having this happen, you're in danger. But there can be times where you could have what's called a cytokine storm. There's multiple reasons why a person would have a cytokine storm. And that's what's circulating around the internet now. Don't give elderberry syrup because you can cause a cytokine storm. Can elderberry syrup cause a cytokine storm in somebody that has a virus or bacteria? Very, very low risk chance of that happening. I think that's where it's a lot of misinformation out there, and you have to be careful. You want to stimulate an immune response so that you can have a healthy immune response. So if you are exposed to any pathogens, remember, go back to this picture here. If you're exposed to any pathogens, you want to be able to kill those pathogens. So here's the pathogens that you're exposed to. You want a healthy immune response so you can fire a TH1 response and kill those pathogens. So using immune stimulants is the right thing to do. So this could be what a cytokine storm looks like. And it's usually in an unhealthy person or a person that has an autoimmune disorder. So we'll touch on that. So again, a normal cytokine experience. You are exposed to a pathogen. You fire, but your body makes these cytokines. A cytokine storm is really when you're making all these cytokines in excess when there's no pathogen there, and it can cause endothelial damage. It can cause, other organ damage, and that's not what we want to take place. Actually, what we talk about with cancer patients is they tend to be stuck in a TH2 dominant mode. A TH2 dominant mode, if we go back to this slide right here, is we're making way too many TH2 cytokines. This is your B cell response, and this is not the killer cell response. So the TH1 is really the killer cell response. That's what we want to be in. When we're stuck in a TH2 dominance, then cancer can progress. We're not stimulating a healthy immune killer response. And when we're not stimulating a healthy immune killer response, then disease can continue. Now, we have in this slide, it says tumor progression, but we could also say bacterial infection progression or viral progression, because this side on the left, this TH1 response, is how we kill things. We kill cancer cells through that TH1 response. We kill virus through that TH1 response. We kill bacteria and fungus and mold and everything else through that TH1 response. This is how we kill pathogens, including tumor cells. So if we want to stimulate a TH1 response, we have to use immune stimulants. That's why every single one of our patients is on an immune stimulant to stimulate that TH1 response. And that's what that's what the Rife is trying to do too, and it's trying to cause your body to fire in a response against those cancer cells. When you run a viral program on the Rife, you're trying to get your body to fire an immune response. When I say immune response, we're talking about a TH1 response. How do you fire a TH1 response? You have to have your body make cytokines. Cytokines that will stimulate a TH1 response. So this whole idea that's out there on the internet right now that don't give your kids elderberry if they have the disease because they could get a cytokine storm is really quite ridiculous. Yes, can you get a cytokine release? Well, you better get a cytokine release when you stimulate your immune system. So they've taken information off of studies. Okay, here's a study that black elderberry will stimulate a cytokine release in a person. Well, that's what makes it a good immune stimulant. So that's what makes polysaccharides a good immune stimulant. They're going to stimulate cytokine release. That's what makes anything that would be labeled as an immune stimulant a good immune stimulant is that it's going to cause a cytokine release and stimulate a TH1 response. Now, when is it bad to stimulate a TH1 response? Can it be bad to stimulate a TH1 response? I'd say, yes, it can be bad to stimulate a TH1 response. So again, elderberry or any other immune stimulant will stimulate a TH1 response. And it will stimulate TH1 cytokines in order to help create mature T cells and mature macrophages to help kill that pathogen in order, whether it's the virus or bacteria or whether it's cancer cells. But when is it bad that this could take place? The only time it would be bad to have a cytokine release, which we would then call a cytokine storm, is if a person has any history of hyperhistamine-like reactions after any immune stimulation. And who would these people be? Well, I submit to you that these would be people with a TH1 dominant autoimmune disease, like phase 3 Lyme patients. So let's look at this again. Look at this picture, help you understand this. Your immune system creates these different cytokines that stimulated TH1, TH2, and those other ones like we talked back here, mainly TH17 responses. So those responses help you kill different things in your body. Your TH2 is mainly your side of the immune system that makes B cells and makes antibodies against these things. But when we have an autoimmune disease where we're stuck in a hyper TH1 response already, which is like an autoimmune phase 3 Lyme patient, then we don't give immune stimulants. That's why it's all over my books. When a person is in phase 3 Lyme, you don't use immune stimulants because immune stimulants are going to just stimulate your body to kill that which you have antibodies against first, and that's the definition of an autoimmune disease. So an autoimmune disease is when you have self-antibodies, and when you stimulate an immune response to somebody who has self-antibodies, you're going to kill that self-tissue. So you don't stimulate an immune response to people who have self-antibodies. Now, in my last book, and I took it out because it's a misunderstanding about it in my new updated version, is that I say cancer is really an autoimmune disease. Well, it's not technically an autoimmune disease because a person doesn't necessarily have to have antibodies against self-tissue, but cancer is really like an autoimmune disease in that most cancer patients are stuck in a Th2 dominance. So what's a Th2 dominance? It's when their killer side of their immune system is working a much less than their Th2 side of their immune system. So they're imbalanced Th2 dominant, therefore they're not making adequate Th1 immune cells, macrophages, and T cells, and that's why the cancer can progress. So remember, why does a person get cancer in the first place? Because something got inside the cell and caused that cell to go into rapid replication, possibly caused the blockage of the apoptosis pathway. So it's not going through apoptosis, not going through normal programmed cell death, and it's in rapid replication. Well, shouldn't my immune system recognize it and kill it? Yes. Okay, so in every human being, probably hundreds of times through their lifetime, does this happen. Something gets inside the cell and causes that cell to go through rapid replication. But if they're not in a situation where they're stuck on a Th2 dominance, their Th1, Th2 balance is sufficient that they will stimulate a Th1 reaction and therefore create mature macrophages and T cells and therefore kill that growing cancer. And then they never get a diagnosis of cancer and they never knew that they had cancer. So does everybody have cancer cells? Yes. But if they have a healthy Th1, Th2 balance, they're killing those cancer cells and they're never getting a diagnosis of cancer. But we could get stuck in a Th2 imbalance. Stress can cause a Th2 imbalance. So even going through, so here's my episode of cancer is forming in my body. And instead of having a normal TH1 response because I'm under a lot of stress, I'm in a TH2 dominance. Therefore, I'm not getting effective maturation of macrophages and T cells in order to kill that growing cell mass, because I'm stuck in that TH2 dominance because of, let's say, stress. Then the cancer is able to progress and progress and progress. And now my immune system is not strong enough to kill it. And now I get a diagnosis of cancer. So in every cancer therapy that we use from a natural perspective, just about every one of them, we're trying to stimulate an immune response. When we say we're trying to stimulate immune response, more specifically, we're trying to stimulate a TH1 response. So that's the killer side of the immune system. We're trying to boost up that killer side of the immune system. Again, stuff that's circulating out there about coronavirus. Don't use elderberry because it stimulates a cytokine reaction and you could get a cytokine storm. The chance of you getting a cytokine storm from taking elderberry is really if you have an autoimmune disease. So if you have phase 3 autoimmune Lyme, or you have a very serious autoimmune disorder, and you're trying to stimulate an immune response to kill the possible virus that you're exposed to, yes, you could end up with a cytokine storm. You could feel like a hyperhistamine reaction or worse. So you do have to know if you have an autoimmune disease. And I would say, I guess the information on the internet is right. If you're phase 3 Lyme, you shouldn't be stimulating the immune system then. So that's where you got to use a rifle to kill it and protect yourself. But we're talking with any cancer patients, or 99% of probably 100% of the children out there. Using elderberry syrup is a wise thing to do to help increase the balance of your TH1 side, push this side to kill any pathogens that you might be exposed to. So I hope that clarifies that a little bit. That was one major question that we had coming in. I will open it up now and unmute everybody and see if you have any other questions that pertain to this or anything else. I did want to share this slide. This is that what we talked about in that video, the ursolic acid, which is a new product that we have in for cancer. And for viruses and an immune response. Super excited about that product. And then our clear Immuno Plus, which actually now has a nice glass bottle, which is even nicer. So any other questions? Nothing?
Dr. Connor?
Yes.
I don't claim to understand everything that you shared with us, but where do the thyroid hormones, the TH3 and the TH4, do they play into this?
Okay, so let's not confuse this. So a TH1 response is T helper cell 1. T helper cell 2 has nothing to do with the thyroid. These are immune cells. So T3 and T4, those are thyroid hormones.
Okay, thanks.
So your thyroid makes about 94% T4 that will then convert to the active form of T3 in the liver and the gut. And T3 is the active thyroid hormone, has nothing to do. I know it's very confusing because you go, oh, you think TH, oh, that must be short for thyroid. It's very confusing. TH1, TH2, these are T helper cell 1 and 2. These are immune system chemicals, terminology, not thyroid.
Okay, thanks.
Somebody had a question. A local clinic is offering vitamin C and other drip infusions. Would these be good for me? So vitamin C is an immune stimulant. So vitamin C is a TH1 stimulant. So vitamin C is good for viruses, bacteria. Absolutely. Very good. Are they good for cancer? Sure. Can be good for cancer too. Why? Because if it's stimulated immune response, what is it doing? It's helping to kill cancer cells. So anything that you can do to stimulate an immune response is going to help your body kill cancer cells. And that's why, people go, well, alternative cancer didn't work for my friend, or alternative cancer isn't working for me. Well, you do have to have a healthy enough immune response to kill that cancer. And you have to be able to get on it as fast as possible too. That's why, it would be, I wish that, alternative cancer was the first thing everybody chose, and then they would choose to do standards of care if they had to build up their immune system. Because here's the sad thing: what does chemotherapy and radiation do? It just destroys all of this. It destroys the whole thing, and then you can't make your white blood cell count is just in the pits, and you can't make macrophages and T cells. And how are you going to kill this? It makes it much more difficult. I know that chemotherapy is sometimes important, and you have to do it, but you certainly want to then double down on stimulating immune response if you're going to do that. All right, so hopefully this was helpful for you, and maybe everybody's like, I didn't see anything about elderberry syrup and cytokine storms out there. But there's a lot of, I think, misinformation going around, and I think part of that was pushed by, there's companies that and pharmaceutical companies for sure that don't want people using any nutrition for this virus, and the video that I made yesterday on the coronavirus and talked about the new products that we have for that was, when I published that video, I got a notification immediately by YouTube saying that since we don't have as many humans looking at these information, our computerized intelligence will probably flag your video and it won't be able to be seen by anybody. Because you're offering information on the coronavirus. It's just unbelievable. So there's a huge suppression of information that's going on that we're dealing with, and they don't want people doing natural things to stimulate their immune system, which I don't get. I mean, they don't even. There isn't any medication that's valuable for viruses. I don't know. I think they just want everybody to be sick or something. I don't know. It's very sad. But so just be careful. You see stuff out there on the internet and stuff, even by functional doctors that maybe are fearful and picking up wrong information and sharing it. Bring it to us. Not that we know everything, but we'll certainly do the research on it and look at it. Share it on the Facebook page. Ask questions about it so that we can try to clarify it and clear up anything that's out there. All right. Well, you guys have a wonderful day. Keep asking questions on Facebook and sharing questions with us on the email. Just please put it in the email location that it's a question for the Zoom call. And you guys, we will talk to you again next week. Bye-bye.